did my topic on asthma. The population for education is a classroom presentation for parents of children with moderate to severe asthma. The idea being that they see a specialist like a pulmonologist, or they're in the ER a lot or the hospital for admissions related to asthma, and so they're referred to this class to help them understand their child's diagnosis and disease process. The education level would be varying, but they would have to be literate in English speaking in order to be able to participate and understand the class. So the learning objectives, the learner will be able to evaluate a patient in an asthma exacerbation by identifying 2 signs and symptoms and applying the correct zone of the asthma action plan for treatment, like the yellow, green, or red zone. And then the learner will be able to implement through return demonstration at least one appropriate treatment option or options for a patient in an asthma exacerbation. And finally, the learner will be able to compare through verbalization 3 differences between healthy lungs and asthma-affected lungs. So what are some of the signs and symptoms related to asthma? The most common that you'll see are chest tightness, coughing, wheezing, and shortness of breath. And here, what causes an asthma attack? Sometimes it can be genetics. If a parent or grandparent has asthma, then it might be transferred to the child. Environment and lifestyle, it includes exposure to smoke. That could be cigarette smoke or campfire smoke, perfumes, strong odors, allergens, dusts, cleaning materials, all sorts of air allergens, environmental allergens can affect asthma. That's why I have a picture of this beautiful tree setting, because people with asthma might not be able to enjoy that so much if they're allergic to cedars or elm trees, different kinds of things like that. Also, respiratory infections can trigger an asthma attack, like bacteria, virus, and then I have more specific allergies down here: pollens, grass, trees, dust mites, cockroaches, dogs, and cats. So in order to prevent an asthma attack, you would look at avoiding aeroallergens, avoiding the triggers. Modification would be to prevent and modify the actual exacerbation by treating it with things like albuterol, certain medications that can help modify the severity of the reaction. And then restoration would be the medications, the long-acting controller medications that help restore the lungs and prevent any kind of asthma attack to begin with. So here I have the pathophysiology, healthy lungs versus asthmatics. So essentially an irritant enters the lungs and can cause inflammation. So here I have the narrowed airway as an affected asthmatic patient, and then the open airway. So this is what the lungs should look like if you're a healthy patient and say a dust particle gets into your lungs. A healthy lung can get rid of that particle without any issue. But an asthmatic, their bronchioles are going to start narrowing, and then the smooth muscle around the bronchioles will constrict, and so that causes difficulty breathing. And here I have another picture where the inflammation is a little more severe and easier to see, where that's the normal lung, that's the normal bronchiole, and then that's the inflamed bronchiole. And you're looking at the bronchioles, so here's the branches of the lungs, and the bronchioles are the smaller branches coming off of it. I also wanted to show the alveoli, because here on the capillary level, the alveoli are at the very end of the bronchioles, and on the cellular level, the bloodstream is coming in, and there's capillaries on the alveoli where they exchange oxygen and carbon dioxide, and that's how your lungs oxygenate the rest of your body through the bloodstream and perfuses to other vital organs, your extremities, that kind of thing. And so it's exchanging the oxygen that you breathe in, and then the cells that are coming through the bloodstream are pushing out carbon dioxide back through the lungs, so you're exhaling carbon dioxide. So what do I do when my child has an asthma attack? The biggest thing is to follow the asthma action plan. It's usually prescribed by a physician or a specialist pediatrician, like a pulmonologist, and it has your green zone, yellow zone, and red zone. And it will tell you the symptoms that your child has and then what to do. So if you're in the green zone, the symptoms: you're breathing well, no cough, no wheeze, can work, play, go to school fine, so you'll just be taking the daily medications. Your child will take the daily medications. If you're in the yellow zone, symptoms start flaring up like a cough or a wheeze, then you'll start more of the quick relief medications like albuterol. red zone is going to be more urgent. Sometimes that's where you'll start implementing things like oral steroids and some longer acting drugs that are going to get you out of this acute exacerbation. I have here some examples of the medications. The biggest key ones to remember are ProAir and Zopanex. Those are the brand names of albuterol and levoalbuterol. Albuterol is the quick relief rescue inhaler that helps your child in an acute exacerbation, meaning if your child is wheezing, coughing, and any kind of urgent symptom, you need to give them their quick relief inhaler, the red inhaler or the blue inhaler. These inhaled corticosteroids and combination medications, these are combined steroids with other inhaler aspects, help with the long care treatment of your child's asthma. So things like Advair, Alvesco, Asthmanex, all of those prevent the inflammation from a long-standing point. So these aren't going to help your child in an exacerbation. These bronchodilators up here will. The long-acting bronchodilators and the anticholinergics are really for when these medications fail. Then the doctor might add on some extra ones like those. Equipment that you might use with the child is a nebulizer machine and then the spacer. This brand particularly is an aero chamber, but there's different brands out there that are appropriate for your child, and you'll see that there's different sizes with masks or mouthpieces, and we'll go over that in a video later, how to use it specifically, but you want to make sure that you have this equipment available during the exacerbation. And then the rate of asthma, it's the highest occurring lung disease in the world. It affects over 300 million people, mostly in high-income countries, but the death rate is low with the medical technology we've had and the education we can provide about medications and prevention. They have a relatively low mortality rate. So some classroom activities that I have scheduled. We're going to do an intro video about asthma, and then you'll take a pre-assessment quiz and then a post-assessment quiz at the end of the class to see if there was any improvement in the education. This slide presentation, an online video about the use of spacer and nebulizer. We'll have an opportunity to practice with the equipment, group discussion about their personal experiences in asthma, and then the learners will divide into simulated scenarios to talk about what the do's and don'ts are of a child in an asthma attack. And then there will be an opportunity for question and answers with the instructor and a handout as well. So some questions that you might have at the end of this presentation: will my child always have asthma? Is there a cure for asthma? Does my child have to see a specialist, or can they just see the pediatrician? If my child's allergic to their pet, will we have to get rid of the pet? Things like that. And then the evaluation criteria of learning, linked to objectives and expected outcomes. The link to objectives is the recognition of asthma-related symptoms with coordinated use of an asthma action plan assists the learner to be able to evaluate a patient during an asthma exacerbation by providing specific instruction on appropriate interventions. And then demonstration of proper use and technique with the asthma-related equipment links to the objective to make sure that they're able to use that equipment. And then review and instruction of the pathophysiology allows them to understand the objective of the differences between the healthy lungs and the asthma-affected lungs. Evaluation of the learner would be the post-assessment quiz, a course survey or evaluation that I generated to make sure that the learner felt like they learned something new in the class, and then ensuring that the instructor reviews the return demonstration of each learner so that they understand the equipment and the use of medication. And then expected outcomes would be increased knowledge and the ability to recognize asthma symptoms, the ability to use the asthma action plan correctly and appropriately for their child who has asthma, utilize the equipment correctly, and then increased knowledge about asthma's effect on the lungs, the pathophysiology of that process.